Next, we're going to go into the Pilates bent knee series. So this is a whole little mini movement set in itself. So we're going to start lying on the floor. So if you can get yourself down to the floor on your yoga mat, that would be ideal. If you can't, I will show you the series standing up, but first I will show it lying down. So we'll imagine that I'm laying on the floor. So we'll come to the floor. We're sitting up nice and tall, and you're going to need to bring yourself down. So however you can do that, you can hold the back of your legs, lower yourself down gently, and draw your heels towards your glutes. This is called the bent knee series. So from here, we're going to start by lifting the heel and setting it down. That's 1 and 2 and 3. So we did that already, but now we're doing it lying down. Now we're going to lift the heel and we're going to float the leg up into what we call in Pilates tabletop. And then we're going to send that leg down and tap the foot and bring it back up. Now the movement's coming from the hip joint. So everything is nice and quiet and stable, and it's only the hip joint that is moving in this exercise. So take care to avoid dropping your foot down to touch the mat. You just want to lower the whole entire leg in that 90-degree angle. And you don't have to worry about tapping the mat. You can just lower it a little bit and then bring it back up. Let's do one more. Lower it down 90 degrees, tap or no tap, and bring it back up. And then we'll set it down, toe, ball, heel. Draw it in slightly for support, and let's do that on the other side. Now, if you are standing because you can't go to the floor, you can do that exercise by supporting yourself. You can hold on to something or a wall. Other hand can come on the hip. And what you'll do is you'll just float the leg up. This is 90 degrees, and see if you can send it back. And if this is too much for you, you can float it up and set it back down, and float it up and set it down, or again, float it up and send it back. It's a little bit different muscle groups slightly, but you still have some of the similar movement benefits. Okay. So after we lifted our heel and lowered it 3 times, 3, then we went and we lifted and lowered our knee into the tabletop position and down, and tap or no tap. That's not important. What is important is that you stay stable through the center line and you only move through the hip joint. And then we'll set that foot down, toe, ball, heel. Now we're going to progress that movement. We're going to float the foot up into tabletop. We'll stretch it as high as we can, flex and point, fold it, take it down. Right comes up, we stretch it, flex, point, fold it, take it down. One more each side. Bring it up, stretch it like you're trying to touch the ceiling with your toes. Fold it and take it down. And the last one, tabletop, lengthen it, flex, point, fold, and take it down. Now, if that was already challenging for you, do that set again, but we're going to progress it a wee bit here. So now you're going to float it to table, extend it to point, flex it, now bring it down. When it hits the mat, you'll point your toe and draw it in. Let's do it 2 more times on the left. Float it tabletop, extend it to touch the ceiling, dorsiflex, that means the toes point to you, the heel points upward, and then you'll bring it all the way down. Now, this is challenging because you have to hold your abdominals while you lower the leg down. Pointy toe, flex, and come down. And then we'll change. Excuse me. Right tabletop comes up, lengthen it, flex, dorsiflex, bring the heel down. When it touches the mat, you point it and you draw it back in. And we come to tabletop and we lengthen and we flex and we bring it down. Let's do 2 more. Draw it in. So you're really having to contract and hold your belly button down and your abdominals contracted. They are the ones that are helping to stabilize the pelvis while the leg is moving. And then we'll bring it back. So now from here, the next set is I'm going to position my fingers, my right fingers on my right thigh, and I'm going to drop open my left knee and come back. So I'm holding my right knee because I don't want the right leg to move, only the left. And I'm doing it slow because I really want just the left inner thigh muscle called the adductor to work. Let's change it. Now I'm going to stabilize my left knee and slowly open my right knee, and then I'll close it up. And once again, no movement on the left, only the right, and then bring it back. And I'm taking care so that when I open my right knee, my left hip doesn't release from the floor. We got to hold that down and bring it back. Now from here, could I stabilize my pelvis and open both knees and then close them both as if my inner thighs have 2 magnets inside of them and they're attracting each other back to the center line? That's 2. We'll do 2 more. And my belly button is sinking down because I want the pelvis to be heavy. Just 1 more. Opening through the knees and then closing. Wonderful. So that completes the bent knee series in the supine position. Let's turn on to our side. There's 2 parts to this little mini series. The first is on our back and the next is on our side. So now we're going to lay down on our side. You can make a little pillow with your hand if you want, or you can even get a little mini pillow or cushion or a towel rolled up for under your head. From here, you're just going to float the leg up and bring it down. So this continues the bent knee series, but now we're doing it sideways. So from here, your knees are still bent in that 90 degrees, and you're just lifting it as high as the hip. So you don't want it up here. You just want it a little bit, and then you'll close it. Let's do 4 of those. Float it up and take it down, and float it up and take it down. 2 more. And 1 more. Rest for a moment. And while you're here, that top hand is pushing into the floor because you're trying to lift your ribs best you can. So now the next exercise in this bent knee series is called the clam, the baby clam. So the feet are going to stay glued together. Now the knee is going to flare open, and then it's going to come back down. And it flares open again, and it comes down. We'll just do 2 more. So these exercises are really important to keep your gluteus medius strong. That helps you with your walking. Let's do 2 more. We'll make 6 altogether. And if you notice, I'm doing them slow. So there's no speed in Pilates. We're more concerned about quality rather than speed. There you go. So that was 6. All right. 2 more little mini exercises in this set. We float the knee up and think about a gait, and your hip is the hinge. So you're going to do your best to keep it hip level. You'll swing it forward. You'll send it back. Forward and back. Just 1 more. We're just doing 4 of these. Forward and back. And then bring it down and rest. All right. The last one is a circle with the hip. So you'll float the knee up a little bit and you'll come forward, up and around. So think about stirring with your knee. 2, you're making a big circle. Just 3 of these. Good. and then you're going to reverse it and make the circle in the opposite direction for 3 and 2 and 1. And then both knees will rest together. Take that hand and you're going to push yourself up, carefully coming up, and then you're going to change to the other direction. So I'm going to come standing and show you how to do this standing for the other side. So if we are on our side, imagine we're laying down on the opposite side. So I'm going to be working my left leg. So the first thing we did was the lift and lower. So you can bend your knee slightly, take it back slightly, and you'll just open it and close it. So if I'm standing facing you, it looks like this: open and close. And again, feel free to support yourself with a wall or a chair or a table, whatever you've got. Okay, so I'll stay sideways. Let's do 2 more. And lower, and bring it open and lower. 1 more, open and lower. All right, so that was the bent knee, lift and lower. Now we're going to do the baby clam. So the baby clam from here is you can prep, or you can bring your knee, your foot up higher, just below the knee on the shin, and you'll open and close and open and close. Now, if that's difficult to balance there, even with some support, leave your foot prepped on the floor and just open and close. So you're just pivoting on your toes and metatarsals, and you'll bring it back. So you open and close, just 2 more, open and close, and 1 more, open and close, and then rest. You might want to shake out your legs a little bit. Next, we did the bent knee side kick. So if I'm sideways, I'm going to bend my knee and I'm going to bring it up and send it back and bring it up like it's a swinging gait. And my hip is the hinge of the gait. So nothing else is moving in my body, just the knee coming forward and going back. And you can do about 3 or 4 of these. I'm showing a few more so you can get the idea. Certainly you don't have to follow along with me exactly on the count. You do what you can and then bring that back. And then the last exercise was a circle. So we're trying to get the big hip bone, the leg bone called the femur, the big head, which goes into the socket of our hip. We want it to spin around to keep the mobility. So if I'm standing, I'll do that exercise like this. I'll just pretend that my knee has a giant spoon or a marker in it, and I'm just doing a big circle, stirring or creating a big circle with a line, drawing a line. That's a circle. And then I'm going to reverse that, and I'll go the other way. Now, if this is hard to lift your leg, again, you can send your leg back and you can draw the circle partially with your foot and toe, partially with the hip. You got to just kind of make it accessible for yourself, but the movement is still there. The base movement is still there. My hip joint is still moving in that circular pattern, and bring it together. That concludes the bent knee series. We did it supine, which is laying down on our back, and we did it side lying. All of those exercises are meant to strengthen the hip joint and give you some strength through the abdominal area, as well as work the glutes, some of the glute muscles.